Okay, I'm starting off here with my room scan. Nothing on the walls, nothing on the floor. These are my materials over here and my patient, Sophie. Okay, I'm going to put the camera up and perfect, okay. Good afternoon, everyone. My name is Emily Rocamboli. I am a student at the University of South Alabama. I'm in the Family Nurse Practitioner program, and today I'm going to be filming a complete abdominal assessment. I have my patient here, Sophie. Do I have your consent to film this for the purposes of school?
Yes.
Okay. And are you having any abdominal pain, discomfort today?
No.
Okay. And have you recently emptied your bladder?
Yes.
Okay, perfect. So I'm going to have you sit down here and then lay back. I'm going to provide you with this sheet for privacy. If you want to lower your pants a little bit down just to your groin level and tuck this in, and then as well as lift your shirt up just below your breast. Okay, I'm going to perform hand hygiene. I'll be right back. Okay, that's perfect. So the first thing I'm going to be assessing for is just an inspection of the abdomen. I see that the umbilicus is midline, it's inverted, she has a piercing there, she has a small tattoo in the right corner, but the skin looks clean, the temperature is normal thermic, it's dry, I don't see any lesions, I don't see any ascites, I don't see any bruising, no rashes, everything looks good. Coming down to eye level, I'm looking for aortic pulsations or peristalsis. Since she has a flat abdomen, that's easy to see. I do see some aortic pulsations there. Perfect. Next, I'm going to be moving on to the auscultation or listening portion. I'm going to be using the diaphragm of my stethoscope to listen in all four quadrants: right upper, right lower, left lower, and I'm listening for peristalsis, bowel sounds. Some gurgling or clicking noises are absolutely normal. I expect to hear between 5 and 35 per minute, which is normal active bowel sounds. I will be listening in 15 seconds in each quadrant if I'm hearing that. If I'm not hearing any bowel sounds at all, to be able to be called absent, I would have to listen between 2 and 5 minutes in each quadrant to actually say that that is completely absent. If that is the case, it would be indicative of an ileus. Hypoactive bowel sounds under that 5 are going to be indicative of like a recent bowel surgery or a possible the beginnings of a small bowel obstruction, and I might hear a high-pitched like tinging sound. And hyperactive bowel sounds, which is more than that 35, could be indicative of some diarrhea as well. Okay, so I'm going to listen now at this point with the diaphragm. That's some good bowel sounds. Perfect. Okay, so we listened to 15 seconds in each quadrant. I heard plenty of bowel sounds. Still normal active between that 5 to 35. Next, I'm going to be listening with the belt of my stethoscope. I'm going to be listening to the arteries. The first one I'm going to be listening to is the aorta, very large artery coming straight down midline, posterior to the umbilicus and superior to the xiphoid process. We're going to be listening right in there. What we're going to be listening for is something called bruise. Bruise is a turbulent sound that can be heard with narrowing of the arteries due to an atherosclerotic disease. Perfect, no bruise heard there. Next, we're going to be moving on to the renal arteries, which are branching off of the aorta to the right and to the left. The same thing, I'm going to be listening for bruise there. We're still above the level of the umbilicus at this point. Perfect, no bruise as well. Now we're moving on to the iliac arteries, which are below the level of the umbilicus, again to the left and right, branching off of the aorta. Again, important to know that we're only using the bell of our stethoscope for this. No bruise left and no bruise on the right. And then lastly, we're going to be moving down to the femoral arteries, which are in the groin crease, and that's going to be the last arteries that we're going to be checking. No bruise on the right. And no bruise on the left. Perfect, that's a normal finding. So next we're gonna move on to percussion. Percussion is being able to hear the different sounds within the abdomen. I'm going to use my non-dominant hand with my dominant hand banging on my middle finger here to percuss the abdomen. What I'm listening for is two different sounds. Tympany is an area of hollowness or air, and dullness is an area over either a mass or an organ or something more solid. It could even be certain areas of the intestine where there's fecal matter or food particles, okay? So I'm going to go systematically through all the quadrants listening for the percussing for sounds. Perfect, okay. I did hear a little bit of dullness in the left lower quadrant, but that's where the descending colon is, so that could be normal fecal matter within there. Okay, next I'm going to percuss the borders of the liver. So to do so, I go mid-clavicular line, I go past the umbilicus, and basically start at an area of tympany and work my way up until I hear that dullness, which indicates the bottom border of the liver. So here. Oh, you hear that change? Okay, so we're gonna mark it. And then I'm going to do the same thing, working my way down mid-clavicular line, starting about the third intercostal space, working within those intercostal spaces until I hear the change from tympany to dullness. Right there. We're going to mark that. A normal adult liver is between 6 and 12 centimeters, so we will measure to make sure we're within the range. And you have just slightly over 8, 8 1/4, I'm going to call that, so within that range. Next, I'm going to percuss for the spleen. I should not be able to percuss the spleen on this side, so if I can, it's a sign of splenomegaly, which is an abnormal finding. I'm going to start around the third intercostal space, and I'm going to work my way downwards. The spleen is typically located between the 7th and 9th intercostal space, unless there is a large amount of splenomegaly, which it could extend those borders. So I'm going to move this up a little bit here, if you don't mind. Okay, perfect. I've reached the bottom. I don't hear any dullness, so all tympany throughout, so no splenomegaly on that side. Then I'm going to also percuss in the back looking for pyelonephritis. She says she doesn't have any pain, but if we do, we could be a sign of a kidney infection. So I'm going to have you set up for me if you don't mind. And to find that, I find the costovertebral angle. So basically the bottom of the 12th rib right here, and then I find the transverse processes of the spine. And I put my palmar side of my non-dominant hand, and then I'm actually going to give it a thud with my fist. And this should not be painful. You have pain?
No.
Okay. Any pain?
No.
Okay. If that does elicit a pain response, it could be indicative of pyelonephritis, a kidney infection. Go ahead and lay back for me, honey. Okay, so that concludes percussion. Now we're going to moving on to palpation. I'm going to start with light palpation, and then I'm going to go to a deeper palpation. You always want to start with light first, because if the patient's having pain with a light palpation, you don't want to continue to a heavier, deeper palpation. It's unnecessary at that point, just causing them more pain. So you're going to go, again, systematically through each quadrant, light touches. It also gives the patient a chance to just get comfortable with you touching them, so that when you go in a little deeper, they're comfortable with this. Any pain when I do this? Okay. So So now I'm gonna go to deeper palpation. I'm gonna use both my hands in a rhythmic motion. I'm gonna go through. What I'm looking for is any enlargement of organs, any masses, anything irregular that I feel in the abdomen there, okay? Also to note, it's important to look at the patient's face. Sometimes they're not telling you that they're having a pain response, but their face is grimacing or doing something that's indicative of them actually having pain. So you really wanna be noting that as well. Are you feeling any pain when I'm doing this?
No.
Okay. And she said she emptied her bladder, so I'm not feeling any bladder distension down there. Everything feels really good and soft. And I'm not seeing any grimacing when I'm doing this either. Okay, next I'm going to try to palpate the bottom edge of the liver. It should feel firm yet smooth. It should not feel lobular or inflamed. Okay, to do this, I'm using a cupping technique. I'm going to basically take both of my hands underneath the ribs here, and I'm going to ask the patient to take a deep breath in. Go ahead. Thank you. And as it does that, that raises the liver, and I can feel the bottom edge, and it feels very smooth yet firm. Perfect. Okay, go ahead. And now I'm going to palpate for the spleen. I shouldn't be able to palpate the spleen. Only about 5% of the population you can palpate the splenic head. Unless there's splenomegaly, which is an enlargement there. So I'm going to go ahead to do that. To do that, I'm going to take my dominant hand, reach it underneath the back, right where the 12th rib is, and then the same thing on the top with my non-dominant hand, and I'm going to press there and feel for it, okay? Okay. And I am not feeling the spleen, so that's a good sign. We don't have that. Okay, now I'm just going to show you two other points of interest if patients are having abdominal pain, neither of which she is today, but just so I can show you some landmarks for them. The first one is called McBurney's point, and the second one is called a Murphy sign. So the first one we're going to do is a positive Murphy sign, which would mean that pain is elicited when we do this response. So this is a right upper quadrant pain looking for cholecystitis or gallbladder issues. So if I press down in the right upper quadrant and I have the patient take a deep breath in and out. So she did that very easily with no pain. If she did have an inflamed gallbladder, cholecystitis, she would be having a lot of pain doing so, which would be a positive Murphy sign. The next one is McBurney's point. I find the superior iliac crest. I go in about 2 inches from there. And at that point, if I press down, you having any pain right there?
No.
Okay, that is going to be McBurney's point, tenderness, if that is positive, and that's a sign of appendicitis. So neither of those she's having pain with, and that concludes our abdominal assessment. Thank you so much for watching. I'm gonna do one last room scan so you can see, and then that's gonna conclude it. Thank you so much. Okay. Here's everything. Perfect. Thank you.